Hi everyone. Welcome to another interesting lecture from my channel. I am pharmacist Dr. Mwazuzu Izudo. Today, we will discuss another topic of public health importance, Lassa fever. Lassa fever used to be endemic in West Africa, where it kills thousands of people each year. With access to the region improving, the opportunity, and the need, to improve our understanding of this disease, are increasing. With the recent resurgence of the disease in 2022, it is now rapidly spreading to many other regions of the world. What is Lassa fever and how did it originate? Lassa fever is a viral hemorrhagic fever, transmitted by rats. It has been known since the 1950s, but the virus was not identified until 1969, when two missionary nurses died from it, in the town of Lassa, in Nigeria, my native country. Found predominantly in West Africa, Lassa fever has the potential to cause tens of thousands of deaths. Even after recovery, the virus remains in body fluids, including semen. The years of civil unrest in Sierra Leone, from 1991 to 2002, halted the investigation, through international collaboration, of Lassa fever at a specialist unit in Kenema. Also, the increase in international travel, and the possibility of use of the Lassa virus, as a biological weapon, escalated its potential for harm beyond the local level. Access to the country is improving, so renewed efforts to understand it are feasible. Clinical presentation of Lassa fever. Lassa fever presents with symptoms and signs indistinguishable from those of febrile illnesses such as malaria, and other viral hemorrhagic fevers, such as Ebola. It is difficult to diagnose clinically, but should be suspected in patients with fever greater than 38 degrees centigrade, and who are not responding adequately to antimalarial and antibiotic drugs. For diagnostic purposes, the most useful clinical predictors of Lassa fever are fever, pharyngitis, retrosternal pain, and proteinuria. Fever, sore throat, and vomiting are the most useful predictors for outcome. Complications include mucosal bleeding, 17%, sensorineural hearing deficit, 4%, pleural effusion, 3%, and pericardial effusion, 2%. The outcome is related to the degree of viremia, not the antibody response, and is worse with high levels of aspartate aminotransferase. Pharmacological treatment of Lassa fever. Ribavirin and general support are needed. Ribavirin is almost twice as effective when given intravenously, as when taken orally, and if given within 6 days of the start of illness, it may reduce deaths by 90%. Dehydration, edema, hypotension, and poor renal function are common. Fluid replacement or the use of blood transfusion requires careful monitoring. Thank you once again for listening and God bless you. We hope you learned something from this lecture. If you did, kindly subscribe to my channel or follow my page, like and share this video. Bye for now, and see you in the next video.